The risks of breast reduction surgery are wound healing problems at the T-point. Pretty rare in my hands because I'm very gentle with handling the T-point. That's the point just under the areola and the point at the T just under the fold. I think patients have a higher risk of having problems there when they're over 65, obese, have diabetes. Pick two, that doubles your risk. One of those factors, maybe 10% increased risk, but pick two of those and it probably is double. Other factors that are possible risks, very rarely patients have a hematoma, extremely rare. I don't have problems with fluid collections like seromas because I'll use a small drain for a few days afterward because most of my patients are having liposuction, so we're doing that pain-blocking fluid that can leak into the breast and add to that fluid. So I like to put that drain in, get that fluid out so you have predictable healing. I do like to use support mesh. 98% of the patients I do reductions on choose to use the internal support bra. In my experience, I don't have problems with that support mesh having a complication like redness or infection like some other doctors seem to experience because I don't have problems with wound healing at my T-points because I'm so gentle with the way I handle the tissue. Ultimately, healing well is about how you do the procedure from top to bottom and using the correct procedure for that patient. If I'm worried about a patient, for example, if I'm worried about wound healing because they're heavy, have diabetes, or other issues, right? Then I'm going to use a suction dressing called a vac dressing along the incisions. That vacuum dressing stays on for 5 to 7 days and it helps add negative pressure to the wound. What does that mean? It means it's like a suction bra that draws blood to the surface. Like when you put a vacuum or do a hickey on your hand and you see those capillaries dilate and get red, you're increasing the blood flow to that area, improving the wound healing so quickly those wounds heal with that helpful suction bra. So if I'm worried about wound healing, I'm going to put a suction bra on and accelerate the healing, improving blood flow to the nipple, the T-points, along the incision, which really helps with getting safe results. I love it. But I need you to know something really important. For those of you who like to vape or who live with someone who vapes nicotine, or you're a nicotine gum person, toothpicks, patch, or cigarettes, whatever, it's all the same. Nicotine is, I know it's addictive and I know it feels good, but it affects wound healing profoundly. It's like chemotherapy kills cancer, like nicotine kills wound healing. So if you like using nicotine, please stop 6 weeks before your procedure and don't restart 6 weeks after because it's the best result if you heal well the first time. Getting yourself ready for surgery if you're a nicotine person is very important. And so those are the things you need to know about wound healing and breast surgery.